Okay, here we've got bisphosphonate necrosis. This is a drug-induced necrosis of the jaw that happens while taking bisphosphonates, which are used to reduce osteoporosis. Um, with these, you have the bisphosphonate damages the osteoclast. So this is shown by a bicycle with phosphates as the tires and a crow on top. So bisphosphonate necrosis. And then you've got it running over the ostrich's claws. So damage of the ostrich claws, osteoclast. This affects both the mandible as well as the maxilla, and osteonecrosis happens in the entire jaw, so you can actually have it continue and progress throughout the whole jaw. And trauma increases the likelihood of this happening. So some of the bisphosphonates are Fosamax, Actonil, and Boniva. And they're typically used to treat Paget's disease or bone metastases or melanoma. Um, the uh, the jaw is affected mostly because it's under stress, a lot more than some of the other bones. And this does resemble, or a differential diagnosis would be osteoradionecrosis, um, in which the bone infarcts and can't remodel as well. A history would give you the idea, or would help you know whether this person received radiation or not, and that's how you would differentiate between the two. Let's see, this affects the whole bone, both top and bottom, just as much. There are differences with bisphosphonate necrosis versus osteoradionecrosis. With bisphosphonate necrosis, you have the whole bone is affected instead of just an area. Mandible and maxilla equally. That's different, and it can happen spontaneously. Extractions and trauma make it worse. So if somebody is on a bisphosphonate, you want to make sure not to have them off of that bisphosphonate for a period of time before you do an extraction. I want to say it's a year, but I'll have to double check. And then if there is bad bone, don't surgerize. Just cover it with antibiotics. Some initial symptoms of this are pain in the jaw, mucosa breaks down, and you have bone exposure. So just to recap the main things, it's damage to osteoclasts, affects the maxilla as well as the mandible. You have osteonecrosis of the whole jaw, and trauma increases these. So be careful when you do extractions and that sort of thing that somebody is not on one of these drugs.